everyone, to this very, very small and short launch event. My name is Abby Beho, and I am the Program Director at Lake Health and Wellbeing, and really it's my pleasure to welcome you to this launch of our new project, Empower. So before we get started, I just wanted to specifically welcome the Ambassador, His Excellency Michael Lin, the Resident Ambassador, Republic of China, Taiwan, Mr. Virgil Jeffers, the Director of the Department of Gender Affairs, Dr. Marissa Carty, the NCD Program Coordinator at the Ministry of Health, Mrs. Novelia Rollins-Wusu, Coordinator of the Chronic Metabolic Disease Program at the Ministry of Health, Mr. Roy Lo, Team Leader at the Taiwan Technical Mission, Mr. Will Chen, Project Manager, the Chronic Metabolic Disease Program with the Taiwan Technical Mission, Mr. Andrew Sek Koi, Project Manager of WeFip, and everybody else that has joined us today. Thank you so much for everyone who's joined us in the room. Ms. Vera Edwards-France, Health Educator at the Ministry of Health. Thank you so much for coming to this launch of this project. So before we get started with the proceedings, I'm just going to invite Novelia Rollins-Wusu from the Ministry of Health to provide us with an opening prayer.
Good afternoon, everyone. Let us just stand and bow our heads for prayer. Let us pray. Heavenly Father, we gather here today, this evening, thanking you for life, health, and strength. We praise you for this opportunity to launch this initiative, EmpowHer Project, which aims to empower our women here in the Federation of St. Kitts and Nevis living with non-communicable diseases. Lord, we ask that our women will live their full lives and that they may be able to thrive. We pray that our women through these workshops will be better equipped with skills so that they can successfully manage their health condition. And at the end, Lord, we pray that each of these women here today may become empowered personally, financially, professionally, as they navigate their lives living with these NCDs. Thank you for the management of Lake Health and Wellbeing, and for the strong partnership of the Taiwan ICDF program, and all other stakeholders that may contribute to this great initiative. Bless our proceedings this evening. In your precious name I pray. Amen. You may be seated.
Thank you, Mrs. Wusu, for that lovely prayer. We appreciate it. Great. So welcome again, everyone, to the launch of this project aimed at empowering women living with non-communicable diseases. This project is funded by the Republic of China, Taiwan, with support from the Ministry of Social Development and Gender Affairs as part of their Women's Empowerment Initiative contest, and we're very grateful for this support. So thank you so much. We appreciate the opportunity. So today, for us, it does mark an important moment in our mission to make a difference in the lives of women who are facing the daily challenges of managing a chronic health condition. Non-communicable diseases such as diabetes, heart disease, and certain cancers affect millions of people globally, with women being disproportionately impacted. That is why it is more important than ever to focus on the unique needs of women living with these conditions so that we can provide them with the support that they need. So this project was birthed out of a research project that we conducted in 2021 with funding from the Commonwealth Foundation. The research project explored the gendered impact of the COVID-19 pandemic on people living with NCDs in St. Kitts and Nevis. And one of the key findings of this project was that women, particularly single mothers on a low income who are living with an NCD, would definitely benefit from a variety of support and guidance. This was because, as we know, women we're sort of fulfilling many roles and responsibilities, such as being a mother, working, caring for older parents. And then when you have to do all of that whilst living with a non-communicable disease, that can be very overwhelming. And many women that we spoke to didn't have a lot of support in terms of helping them navigate the challenges that they're experiencing with their NCD. So really what we aim to do with the project is to tackle some of these issues by empowering women professionally, financially, and personally. And the reason for that is that we know there are many many determinants of health. And if we can empower women on some finances, economics, professional lives, that can also help to improve their health and well-being, because they will be more empowered to be and equipped to deal with some of the challenges that they face with their non-communicable disease. So we hope that through this project we can help women manage their health and also lead fulfilling lives. So today that we're really happy to be launching this project. I feel like it's an interesting one because it's sort of the intersection of NCDs and gender. So we're looking forward to getting started and making a difference in the lives of those who need it most. So without further ado, I'm just going to ask our first speaker, Honorable Lynn, to provide us with some brief remarks. Thank you so much.
Good evening, everybody. Allow me to adopt the protocol that has so aptly established by Abby. This is so many opportunities that have been here before with all these different projects and the workshop that has been have the graduation ceremony here. And today I'm very happy that we have to start a launch of this series program workshops that organize leg health and well-being. Also is a cooperation between our ICDF Taiwan Technical Mission and the leg health well-being. Especially is the Women Empowerment Project that we implemented from November 29, 2021. The COVID-19 pandemic widened deep-rooted inequality in economy, domestically and globally. Along the gender and socio-economic lines, those least able to bear it, unfortunately, were those who most affected. One of the silver linings of the pandemic is that it placed the spotlight on the crucial issues of women's participation in the labor force, as well as women living with NCDs. And we noticed that in St. Kitts and Nevis, actually, around 70% of the household are headed by single mothers, and many of them with NCDs. That's why this project would like to empower these women with NCDs financially, economically, and of course, give them these ideas and the awareness of how to deal with NCDs, and then develop their personal well-beings and maybe they start up their small business to support themselves. Women actually run this country. We noticed that although we have Mr. Jeffrey here, who leads the Gender Affairs Department, however, most of staff, from the minister, junior minister, to the staff, are women. 90%, I believe, are women and working in these ministries. And we noticed that actually, to my knowledge, there are maybe only 2 ministries are headed by a male PS. The others are headed by female PS. So women actually run this country, although the Prime Minister is a man, but we could trust that in the future, we will definitely have we have already a first female Governor General, so we could looking forward to a new female Prime Minister in the near future. And through this project, we do hope that these ladies with NCDs could get a better life and handling their health status better. Personally, I'm an NCD patient as well. Before I came here in 2018, with the annual health check, I noticed that something wrong with my body. Without CT scan, I would never notice that there's something growing up in my body. So that's my personal experience. I did an operation. It took 12 hours. Operation. First one is a keyhole operation with a robotic operation machine, robotic. Da Vinci, they call it Da Vinci operation. It takes 7 hours, but unfortunately, it didn't work very well. Internal bleeding lost me I have the blood donation, blood injected into my body for about 20,000 cc of blood injected into my body. You know that everybody, we only about 7,000 cc of blood in our body. So that's 3 times of the blood that given to me. So I'm very happy to see that there's a blood donation project implemented by the Ministry of Health. And I personally will strongly support the project. And I also encourage more people here voluntarily to donate blood to the blood bank. That's a little bit away from this project today, but however, my point is that NCD is controllable with healthy lifestyle, avoid smoking, alcoholic, quit the alcoholic and smoking, then your life will be healthier and you could predict that you have better life and have longevities. Then that will keep your family strong and safe. And for those ladies that head the house, that's the most important. You are the most important economic money earners, bread earners, and as also the contributors to the stability and development of this country. I do hope that with leg health and well-being, this project will help more people, especially ladies. I think it's target on ladies to have a better lifestyle. And with this kind of project, our country, my government will continue to support this kind of project in St. Kitts and Nevis. And we do hope a very success of this project. The program said that I have to speak for 10 minutes, but I don't think I could speak for that long. So I will end my speech here. And thank you for everyone to participate in this program. I encourage for those who are interested to register to the program. And it's free, so you don't have to spend any money, but just spend your free time and you could get benefit to help yourself in this project. And thank you.
Thank you, Ambassador Lin, for your remarks and for sharing your personal story as well. We appreciate that, and we appreciate your well wishes and all your support. So next, as if by magic, we have Ms. Azila Clark, Permanent Secretary at the Ministry of Social Development and Gender Affairs. Thank you so much.
Good afternoon to all protocols being observed. First, permit me to apologize on behalf of the Honorable Iseline Phillip. She's presently in Taiwan, attending a women's empowerment workshop similar to what was held in St. Kitts. She sends her best regards for this activity. When we speak of non-communicable diseases, an entire workshop was held last week to begin to break down the realities for us in St. Kitts and Nevis. We all know what we confront. We're not the best with portion sizes. We're not the best with exercise. And then when you add upon that the compounding issues as women, all of our data says our community, though it is patriarchal, it is very matrifocal. But we know we need to transition that to be able to take better care and share those responsibilities. Our women are head of households, 51% of them, according to our last census. We await the summary for the one coming, but we don't expect much changes. We are breaking certain ceilings, but a lot is left to be done. We need to teach. This workshop allows us an opportunity to sit in a comfortable space and begin to break down wellness. It's something that we've all heard time and time again, and if you see the speed I was driving with to get here, you would know work-life balance is not always in line with the responsibilities that women share. So it is an opportunity for you to not only gain education, but gain a village. Changing behavior is the hardest thing to accomplish. I was reading that if I just cut out sugar for 2 weeks, my face will immediately shrink. I'm hoping. I'm so hoping. When we balance the responsibilities of motherhood, raising a home, making a home, as well as our professional responsibilities. The first thing to go south is always our health, because somehow we believe we're going to bounce back. You know, we have that good black don't crack, high metabolism, but they actually don't tell you that it slows down at some point, and at some point it's becoming much earlier for many of us. So I want to strongly encourage everyone to not only participate, but also enjoy. Use the information to change behavior. That is always the connectivity that challenges us. Hearing about NCDs, hearing about these challenges is not the first time it has been done. But we hope by adding the other components of the financial responsibility, our ministry services or provides to the general public certain social protection services, and we know that eating healthier is costly. We cannot deny that. If it wasn't costly, we'd all be talking down on some salads every day. But even that is an expense. It is also culturally expensive because it forces us to challenge what we all know. A lunch plate or dinner plate for us, especially on a Sunday, if it doesn't include 3 pies, 2 meat kinds, and a little bit of green, which is probably just broccoli, it is not a plate. So it is for us to break those cultural norms. We appreciate the collaboration of Lake Health and, of course, the Embassy of the Republic of China, Taiwan, in these initiatives, because our new national gender policy and plan of action encourages us to start to break down these cultural norms, behavior change, confronting what we do, but not just in, as we say, confronting it, but also offering the alternatives. And a workshop like this or a project like this allows us to be able to do so. So with knowledge comes power. But with power comes responsibility, not only for yourself, but for the generations to come. So as always, I wish the workshop and the project the best of luck. I know it doesn't need luck. It has very good management and sponsorship and technical support. And of course, wherever you see within the project gaps and opportunities for continued safeguard of the women that have joined the group, please don't hesitate to reach out to the Ministry of Social Development and Gender Affairs, because that continuity of care is where many persons fall short. And we would love to be more on the preventive and proactive side as opposed to doing the reactionary side. The ambassador was sharing a personal story. I will tell you, I had my son in October of 2019. Then the world shut down. I had a whole plan. He's going to go in daycare for 3 months. I'm on 6 months leave. I'm going to go to the gym. COVID happened. And I just got absolutely lazy. Because when do you actually get a time to just sleep? Don't wake up, don't have nobody calling your phone, nothing. When do you get that chance? So I took full negative advantage of that. And every time they released me for shopping, there was always like an ice cream or an ice cream cone as opposed to some vegetables. So now my knees are telling me that was probably not the best choice to make, considering my office is on the top floor now. And I have to traverse daily to answer questions and concerns that the public has. So I do look forward to learning and reading about what's happening in conjunction with the In Your Kitchen. If many of you have not subscribed yet, it is a wonderful activity. I always said so. If now that was on during COVID, I might have made some better choices. I remember even calling the former minister Eugene Hamilton and saying, like, where is ZIZ to teach you just like some simple exercises and cooking? I was home alone with my son. I mean, when he goes to sleep, what do I do? And so all of this is to build our toolbox. And with our toolbox, we can make better choices. So I wish you all the very best of luck. I look forward to getting some of those tools myself, as it is the goal to lose a couple. Well, not a couple, but we say that in public, a couple. Thank you so very much, and do enjoy. Thanks.
Wonderful. Thank you so much, Ms. Clark, for your remarks. Much appreciated. And so now we're going to move on to Dr. Marissa Carty, the NCD Program Coordinator at the Ministry of Health, for some remarks.
Pleasant good evening to everyone, and do please allow me to adopt the protocol that has already been established. Non-communicable diseases, often referred to as NCDs, are frequently called silent diseases because of the way in which they cause gradual deterioration in health. Current health data indicates that NCDs are the leading cause of death in women globally, with a staggering 18 million women succumbing to their chronic diseases each year. NCDs represent the biggest threat to women's health worldwide, increasingly impacting on women in developing countries in their most productive years. The cost of NCDs to families and societies are high and escalating. And for these reasons, NCDs has been identified as the global risk and one of the most important threats to businesses and economies. The impact of these diseases in women is profound and goes beyond their own health. Women's unique vulnerability to the risk factors of NCDs means that husbands are losing wives and children are losing their mothers. Families across the world incur death and destitution when mothers become disabled by NCDs and struggle to pay for treatment. Every case is a personal tragedy, and collectively, the high cost of NCDs in terms of healthcare and loss of productivity threatens to undermine gains made in other areas of development and health. A woman's right to health is a very important social issue. However, there are several barriers in developing countries that hinder their empowerment, including access to care, where women may face challenges in accessing healthcare services such as a lack of insurance coverage, lack of transportation at times, and even geographical barriers, meaning that they're not living close enough to a healthcare facility. Also, the cost. Healthcare can be expensive, especially for women who require regular checkups, screening tests, and treatments. This can prevent women from seeking the care that they need. Time constraints. Women often have multiple responsibilities, as was mentioned by our PS, including work and caregiving, which can make it difficult for them to take time out for their own health. Stigma. Some women may face stigma and discrimination when seeking health care, particularly if they are from marginalized communities or have sensitive health issues. Bias in the health system, where women may face bias such as being misdiagnosed or not being taken seriously when they report their symptoms. This can result in delayed or inadequate treatment and can have serious consequences for their health. And finally, social and cultural factors. Social and cultural norms can also act as barriers to women's health, such as a lack of decision-making power over their own health, lack of support from family or community, language barriers from migrant communities, and gender-based violence. Now, breaking down these barriers is essential for ensuring that women have access to the care that they need to maintain their health and well-being. However, women who face these barriers are at a higher risk of developing NCDs or dying from them. According to the World Health Organization, cardiovascular diseases are the leading cause of death among women worldwide, accounting for more than half of all NCD deaths. And breast cancer and diabetes are also significant health issues for women. In the Federation of St. Kitts and Nevis, of the total registered persons living with diabetes in the public health system in 2020, 31.5% were men, while 68.5% were women. Of the total registered persons living with hypertension, 31.7 were men and 68.3 were women. Between 2017 and 2021, 439 new cases of cancer were diagnosed, with a female-related cancer heading the list, which was breast cancer at 21.9%. Data received from the last risk factor survey indicated that 83% of the female respondents were classified as either overweight or obese, with 52.5% being classified as obese. Women were found to smoke less and drink less alcohol than men. However, the study indicated that low levels of physical activity, with females being less active than males. Based on these statistics, it is evident that our women are more susceptible to developing NCDs than males, and are therefore at a higher risk of disability and death. But there's good news. This outcome can be avoided through self-care and management. Self-care and management play a crucial role in maintaining good health and reducing the risk of developing NCDs. How, you may ask? Through better management of your symptoms. By taking charge of your health through self-care, women can better manage their symptoms and reduce the severity and frequency of flare-ups. This can include things like regular exercise, stress management techniques, and adhering to their prescribed treatment plan. They can also receive or improve quality of health. Self-care can provide overall well-being and quality of life, which can be especially important for women living with chronic conditions. This can include activities such as relaxation, mindfulness, and self-reflection, as well as social support and meaningful relationships. Better treatment adherence. Women who encourage self-care management are more likely to adhere to their treatment plan and follow their doctor's recommendations. This can improve their health outcomes and reduce the risk of complications associated with their symptoms. And finally, empowerment. By taking control of their health through self-care, women can feel empowered and more in control of their condition. This can lead to improved self-esteem and a greater sense of purpose, which can help to improve mental health and overall well-being. So therefore, I am happy for the initiative taken by Lake Health and Wellbeing and the Taiwan ICDF Technical Mission for developing this timely workshop series. Through the EmpowHer workshop, women will be encouraged and empowered to take proactive measures in preventing and managing their chronic conditions, thereby taking charge of their health. Consequently, it is my pleasure to represent the Ministry of Health at this auspicious launch, and I look forward to great outcomes from the EmpowHer program. Thank you.
Wonderful. Thank you, Dr. Carty, and thank you for providing the data that's really showing that women are disproportionately affected by NCDs. And so therefore, we do need to do something about it so that we can ensure that women can thrive and live well with their condition, as well. So we're now going to move on to Ms. Teresia Herbert Brown. She's our project officer who's working on this project, and she's going to give an overview of the project itself. So over to you.
Good evening, everyone. Allow me to adopt the protocol that was previously stated. Forgive my voice, I'm just getting it back from a cold. So I have a short but sweet presentation about the project, and it's just an overview. I'm assuming that a lot of you already know about the project, so forgive me if it's repetitive. So my name is Teresia Herbert Brown. I am the project officer as Abby mentioned, and so we'll get into what EmpowHer actually is, right? So based on a study previously conducted by Lake Health and Wellbeing, they found that participants, the female participants in particular, they gave some areas that would be helpful to them, that they thought would be helpful in improving their lives. And so Lake Health went ahead and using those topics, we decided to create this workshop series. So it is a series of capacity building workshops targeting women with NCDs. And so, as mentioned before, thank you to Dr. Cardi for all of the statistics that you provided. So that sort of set the tone for why an intervention is needed. So, as mentioned, women bear the burden of NCDs in St. Kitts and Nevis. In general, in the Caribbean, I think it's 8 out of 10 persons in general in the Caribbean have NCDs. So it's important for our community to address it. And women, as we know, are the backbone of the community in St. Kitts and Nevis. How many of us were raised by strong women? Same. So this is why it's significant for us to address their needs. Women take on a lot, and as mentioned before, oftentimes your health and self-care gets put on the back burner because there's just too much to deal with, right? So in particular, low-income single mothers, there's limited time when you need to figure out how the bills are getting paid, have the children taken care of. There's not often time for you to think about how to improve your life, how to accomplish the goals that you want. So this workshop, we're hoping will sort of force our participants to take the time to think about where they want to be, what they want their goals to be. For their families as well, but just for themselves, helping them to live the best version of their lives as possible. All right, so how will EmpowHer work? So the workshops, as mentioned, are free. It's a series of 7 workshops. We have some amazing facilitators, which I will talk about in the next slide. So we try to be cognizant of the fact that our participants live very busy lives and have competing priorities. So most of the workshops will occur either in the evenings or on weekends. Most classes will also be either virtual or a hybrid format to further encourage participation, as well as to try and encourage our Nivision participants to take part. And then the classes will also be repeated at least once, so that to, again, hopefully improve participation. Classes will run from February to June, with the first class beginning on February 25th. All right. So the 7 workshops offered include, the topics include financial empowerment, like career navigation, and I'll talk more about that when I do the facilitators, entrepreneurship, IT skills training, self-advocacy, skill building, and NCD workplace management. We currently have 34 participants pre-registered. We are targeting women ages 20 to 60 or 65, I think it is. So we were hoping to get 60 participants, but 34 is really good so far. So we're really proud of that, and of course, encourage you to continue spreading the word. So now on to our facilitators, some of whom are here tonight. So we have 7 amazing facilitators who are all women and all really doing really amazing things in their life. So we're hoping that our facilitators sort of rub off on our participants, as well as be able to share some of their expertise with them. So first we have Dr. Tamu Brown, who is a local Kittitian. She is a entrepreneurship coach and expert, and her workshop will be helping participants to develop business ideas and to bring it to fruition. Right, so we know our women already work hard. We want to help them work smart and to monetize talents and skills that they might already have, as well as try and teach them some additional skills. So we have Desiree Otley Tyson, who is the Assistant Director of HR at the Four Seasons in Nevis. So Ms. Otley, where she'll be focusing is on within the workplace, negotiating and navigating a space where so that your job works for you and that you're you're able to navigate and create the career that you want. And we want to think of innovative ways to do this. For example, this may look like knowing that you have an NCD and you may need more sick days and more days off. If you're not in a position to get like a pay raise, navigating more vacation days or something like that, something that would be meaningful for you. So that's where Miss Otley will come in. Julia Mandeville and Vania Patrick Drakes, I think I'm saying that right, are from the Barbados Association of Endometriosis and PCOS. And they will be talking about advocacy, health advocacy, so health literacy, making sure you understand the illness that you're living with, and that you feel comfortable advocating for yourself, not just within the workplace, but within healthcare settings, being able to speak with your healthcare providers and understanding and being more of a partner with your healthcare providers. And speaking of endometriosis and PCOS, one aspect of this project that I'm really proud of is us sort of going outside of the traditional ideas of what NCDs are. So outside of just diabetes and hypertension, which of course are important, but thinking of more silent illnesses like PCOS and endometriosis and fibroids and issues like that, that are plaguing some women in our society, and they do affect your ability to work, particularly those that come with chronic pain. And chronic pain in general is just something that's not not dealt with thoroughly in St. Kitts at the moment. So our other facilitators include Ms. Keisha Archibald, who happens to be present tonight. And she is our resident IT expert and programmer, and she will be dealing with internet and email skills, as well as an introduction to Microsoft PowerPoint and Word. And as we've seen during COVID, everything is done via internet, and there are so many opportunities that you didn't think of that can be easily ran through the internet, which is important for people who don't have the physical time to go to be up and down physically. So I'm really excited about that workshop. Next we have Ms. Sharifa Brown, who will actually be our first workshop on the 25th of February. So she's a financial analyst, the manager at the Marriott. So she will also be talking about making your money work for you, how to stretch your money, other things like dealing with health insurance and life insurance, taking out loans, how best to navigate that world, which I think is something we sort of weren't taught properly in school, right? So just giving us some of those skills to help our women use their money wisely. And then last but not least, we have Ms. Vera Edwards France from the Ministry of Health, who is also with us tonight. And she will be speaking about the NCD management in the workplace. So how you're eating in your workplace, how to get physical activity. Most of us are sedentary all day. And as we know, that is terrible for if you have NCDs in particular. So Ms. France will be picking up the slack in that area and with helping our women better deal with that. So we're almost finished. So what do we hope to gain? We hope that our participants are able to garner some inspiration from the amazing facilitators that we have. And I just wanted to back up and say that I'm really thankful to the facilitators for signing on to participate in this project. It just shows that they see value in the project and what the hopeful outcomes are. And we are hopeful that our participants are able to gain as much as possible from them. So we want to see improved intentionality for our participants when it comes to attaining their career and life goals, improved financial self-sufficiency, and an increased understanding of their agency and their potential to advocate for themselves. Right? So we're hoping that these women are able to improve their lives and the lives of their family, to set good examples for their children, to include their sisters and their cousins. And so we hope that the knowledge from these workshops spreads far and wide. But most of all, we are hopeful that they will prioritize their health and be able to live long and successful lives. So that is it for me. So thank you again to everyone for coming out. Thank you to the participants, the potential participants that are here, and we're excited to get started.
Wonderful, wonderful. Thank you so much, Teresa, for a nice overview of the project. So hopefully that gave you a bit of a flavor of what we're aiming to achieve. So now we do have a couple of facilitators in the room. So I'm going to ask Vera Edwards-France to just come up for like 5 minutes, introduce herself, 2 minutes, to introduce herself and just tell us a little bit about the topic that she'll be covering during the project. Because you're tiny.
Good evening, everyone. Please allow me to adopt the protocol that was set before. My name is Vera Edwards-France. I am the health educator in the Non-Communicable Diseases program in the Ministry of Health. I am also the master trainer in the Chronic Disease Self-Management Program, CDSMP. I have been the master trainer in this program since 2015. Some of the information that we learned in self-management is what I will use in this program. Because chronic disease, whether you are diagnosed with a chronic disease, have risk factors for chronic disease, does not disappear when you're at work. Between those 8 hours that you are at work, you have that condition. But most of us don't pay attention to our disease or its management when we're sitting behind the desk, whether we're clacking on the computer, making those phone calls, filing the papers, running around inside of our building. We are focused on the job that is in front of us. But while you are at work during those 8 hours, there's certain things that you can do to improve your health, to reduce your risk, to make yourself feel better. At one point in the health promotion unit, we had created a 5-minute break. At the top of every hour, we would start working out. Right, Dr. Cathy? We'll start working out just for 5 minutes, just to get our bodies moving. And we made it a part of our routine, because if you don't take time out to help yourself, that time doesn't come to you and say, we are ready. That time just simply passed by, and then the next thing you know, you have been sitting in a spot for hours, only moving to use the bathroom, drink water, get something to eat, and then you go back to sit down. A lot of us sit at our desk and eat. We do very little movement while we are at the job. So while we are there 8 hours day after day for 5 days a week, when we try to calculate how many minutes we have utilized to get the circulation going, most of us would, if you're including getting up and going to the bathroom, which you should not, would find that we have not exercised in an entire week. The week goes by, because outside of those 8 working hours, once you leave, you find that you are out taking care of your family or someone else. We do not make time for ourselves. And as we work hard to improve the life of our family, to improve the life of our loved ones, we put ourselves for last. The EmpowHer program is putting you first. This is a moment that Abby and the Lake Health and Wellbeing Program has put forward for you, for us women, to try to put ourselves first, learn how to manage our life, learn how to manage our health, start making plans that would improve our health. Start making plans that will improve the life of our families. And all it takes is just you signing up for a few minutes and learning the list of skills that this program will offer. Last week for 3 days, the Ministry of Health, in collaboration with the Pan American Health Organization, PAHO, conducted the nation's first Non-Communicable Diseases Conference. One of the presenters, Roger McLean of the University of West Indies, said something that stuck with me. He said, the most costly thing we can do is nothing. That stayed with me because in the health promotion unit, year after year, our team sits down and we try to come up with innovative, creative activities that would help person reduce their risk of NCDs, that would help reduce the incidence rates, and most times people do not grab hold of it. We offer these programs for free. We offer health screenings freely to everyone in our federation, both St. Kitts and Nevis, and persons aren't grabbing hold of it. They're like, oh yeah, I checked my blood pressure 3 months ago. I'm good. 3 months ago, what's happening to you now? COVID came onto our shores and the whole world changed. St. Kitts has changed. We are not the person we were yesterday. We have changed. But in order for us to be better, especially women, for us to be better, stronger, we have to improve our skills. The EmpowHer program is created just for us. And I'm asking everyone that can hear my voice, just log on. Take out the time and learn. Take out the time, practice. Take out the time to use what is given to you freely. My name is Vera Edwards-France. I'm the Non-Communicable Disease Health Educator, and I'm also the Master Trainer in the Chronic Disease Self-Management Program. Have a good evening.
Thank you so much, Vera. So you can see a very dynamic facilitator right there, so you're going to enjoy her session. Keisha? Okay, so we have another facilitator in the room. So Keisha, as Teresa said, is our IT guru, and she's really going to, through her workshop, try and empower people with IT skills. So here we go.
And I'm going to be 1 minute. Good evening. My name is Keisha Archibald. I actually work in the private sector. I worked with government in the Department of IT for 4 years and move on to private sector, not in the field of IT, mostly in shipping and logistics, but I have used my IT skills. That is what my education is in, IT, programming, and information systems management. And I've used those skills to help us be more efficient where we are. My turn. Okay. One of the things that I was told to talk about would be, for the trainings, would be IT skills, basic IT skills. After listening to Ms. France, I think Abby set me up, because if I teach people these skills, they're probably going to want to sit down and not do anything else. And then Ms. France is going to come and teach them how they need to walk up and down. We heard about the pandemic, and she was born actually on the brink of the border closures in 2020 in March. And one of the things that we realized is that working from home, working online has become the main thing. Even now that the pandemic has eased up, we find ourselves still working from home. I'm juggling with this young lady who had midterm break, would you believe it or not, today, from school. And so I had to be at meetings with her all day today, and she's now been asking to go to appointments and meetings with me. But I would encourage people to not be embarrassed by it, because a lot of times we feel we cannot do something, we cannot attend to something because we have to take care of our child. And I have her tonight because her dad is working late. And so I brought her with me. Otherwise, I would have probably stayed home and not attended. So I'm going to be talking about, yes, using tools like PowerPoint, using tools like the Google Suite, being able to use emails efficiently, being able to use the web safely, and also juggling, because we use Zoom. We use Teams, we use all these different tools to still stay working. So that hybrid environment, I'm glad that we're including that as an option for delivering the workshops, because I think it is important.
I think it is important for us to be able to manage it and not be embarrassed by the fact that we have kids and roles and responsibilities that may seemingly keep us back. I'm probably not going to be the one who's focusing on the NCDs part of things, but I will certainly focus on how those persons can still find a way to have a job and manage that along with everything that they're doing at home. So thank you very much, and encourage everybody to attend, because I actually like doing training sessions. Say bye-bye.
Bye-bye.
The perfect example of a woman juggling everything. So that is it in flesh. So thank you so much, Keisha. So I'm now going to have Andrew just to give a few sort of closing remarks. Thank you.
Hi, good evening. Please allow me to adopt the protocol that has been said. My name is Andrew. I'm the manager of the Women's Empowerment Project. And thank you all for participating in this great launch event of the EmpowHer project. Since 2021, the Women's Empowerment Project have already accomplished a wealth of results. And this year, we will continue our effort to empower the women of St. Kitts and Nevis. I am pleased that there are more and more NGOs are focusing on and working toward the empowerment of the women. I believe that by combining the resources of government and the non-government organizations, we can be more powerful in promoting women's empowerment throughout the federation. We all know lack health and well-being, let alone pursuing the common goods and the health equality of this federation. It is a brilliant idea to create this supportive environment and opportunities for women, especially with the non-communicable diseases as known as NCDs. In collaboration with the ICDF, the capacity building project for the prevention and control of the metabolic chronic diseases, it's super long, the project name. The EmpowHer project will not just conduct health screening for participating women with NCDs, but also provide chronic disease self-management workshop to enhance their health literacy. By doing this, women with non-communicable disease can be better manage their chronic conditions and advance their overall equality of life. In the end, I hope the EmpowHer project will be very successful with support from the Ministry of Social Development and Gender Affairs, the Ministry of the Health, and ICDF. It is not just beneficial for the women themselves, but also has a positive impact on their family, as they become better equipped to provide for their loved ones and plan for the future. Thank you.
So we have basically come to the end of our short little launch ceremony. So what I wanted to do is just outline some next steps in terms of the project. So our first workshop is going to be this one, Making Smart Money Moves, a financial well-being workshop for women living with NCDs. That's going to take place on the 25th of February. And so you're all very welcome to attend, all the ladies that are in the back and in front. You're all very welcome to attend. So this should be an empowering workshop aimed at really focusing on the financial side of things and how you can really use your money wisely, and also in terms of taking care of your NCD and prioritizing your budget and that kind of thing. So we then will have another workshop on Entrepreneurship 101 led by Dr. Tamu Brown, and that will be a two-part session on the 1st and the 21st of March. So those are the first kind of 2 sets of workshops that are coming up. We have other workshops, like we said, on IT-related workshop. We have the self-advocacy, the self-management workshop, as well as the sort of how to prepare for business success and job success in the workplace. So we do have a number of workshops. So if you're interested and you're listening online, or if you're here in person, and you want some more information, just see us afterwards, and we can take your details and register you for any of the workshops. If you're online and you're watching, because I know there are a few people on Zoom and a few people watching on YouTube, then you can email us at events@lakehealthandwellbeing.com, and then we can get you registered for the workshops as well. So I think in terms of next steps, that's about it. So I will just now just say a few thank yous, but first I recognize Dr. Alpier, who slipped in, so Vice President of the Medical and Dental Association, hello, thank you for coming. So just to do some thank yous. So really, I would just like to take a moment to express my gratitude to everyone who has contributed to making this event a reality. Thank you so much. I'd like to start by thanking all of our speakers for sharing your thoughts and your insights and experiences with us today. I think really people have shared personal experiences, which I find very inspiring, and also has provided us with a powerful reminder of the importance of our mission to empower women living with non-communicable diseases. So thank you to Ambassador Lin for your remarks. Ms. Clark, thank you also for your remarks. Dr. Carty, thank you so much for your remarks. Also, Andrew, thank you so much for your remarks as well. Teresia, of course, thank you so much for your presentation and really setting the scene for our project. Thank you, Vera, and thank you, Keisha, as well, for coming up and also showing us what you are probably hoping to present during your workshops. And thank you, of course, most important, for bringing in the Spirit of the Lord. So, Ms. Novelia, thank you so much for the opening prayer. I'd also like to thank all the facilitators. Some of them couldn't be here today, so of course I'd like to thank Keisha, I'd like to thank Vera, I'd like to thank Sharifa, Julia, Vanya, Dr. Tamu Brown as well, for agreeing to facilitate some of these workshops and really sharing their expertise with us. I really appreciate it. We'd also like to extend sincere thanks to our partners, so the Taiwanese ICDF, the Republic of China, Taiwan, the Department of Gender Affairs, the Ministry of Health, as I said, the workshop facilitators, and all our supporters, really for bringing this project to life. So we have a very, very small team, extremely small, of our team, and I'd just like to thank everybody. So I'd like to thank Teresia for coming on board and really just hitting the ground running and doing a really wonderful job with organizing the different workshops. Tau, who's standing up right there, just like to thank him. He's been doing our social media for us for this project, and he's done a great job. April, who I think is on Zoom, has been our graphic designer, so she created all the imagery for the project. Our Roma Richardson, who's done some behind-the-scenes things in terms of copywriting for us, so thank you so much for the hard work and dedication. And as you can kind of hear, this project is supposed to be a project for women, by women, delivered by women, plus one man. So we really wanted to really try and make sure that this was really gender and women was really embedded into this project. So again, I just want to express sincere gratitude to everyone who's come out today, those that are listening online, those that are on Zoom, and everyone that just made this project, or that's going to make this project a success. So speak it into being, it's going to be a success. So, so thank you so much for coming today. I think we should have some refreshments outside, so we shall have some refreshments outside, so feel free to indulge with healthy refreshments. And if you have any questions, like I said, Teresa and I will be right here, so we can get you registered and we can answer any questions that you may have. So thank you very much.